Okay, guys, I got cut off here and I just wanted to finish some thoughts briefly on positioning. So the ideal position then would be 90, 90, 90. I don't know how many 90s that is, but this guy that's upright here, okay? Um, so here he's sitting upright and his arms are supported, and that's going to be the best position. Uh, the others are going to have more of a risk of poor swallow. Okay, so that's not the position that we're going for. However, there are certain circumstances where someone is not able to be upright all the time. So maybe they have just had blood pressure concerns. Maybe they have just had surgery and they can't be upright beyond such a degree. So those are special considerations, right? And those would take precedence. Moving on here to some more thoughts. Let's get me out of the way if I can. Okay, so first, making sure folks with dysphagia are sitting as upright as possible. Prop them up with pillows if they are unable to sit erect themselves. And that's a very real possibility that after their stroke, they may not be able to sit upright by themselves. So they may take some positioning devices that way. Preferred that the head is tilted forward and with their chin down. And I've actually mentioned that to you guys before in class. We talked about the chin tuck swallow, and so I'm going to have you guys go ahead and try that now. It's a compensatory strategy, and what you do is it forces a stronger swallow. So this is something, go ahead and try it. So tuck your chin. And force that swallow. It's hard. And so it being harder makes it a more voluntary. You have to think about it. You have to push. All those muscles have to work together. And that is something that you would look for. Now, places that would not be indicated would be if your individual is having difficulty, not so much with the swallowing, but with the getting the food back, localized back to the back of the mouth to go ahead and get it into the swallow phase. So you have to think about which part of the swallow is affected. But for the most part, if someone is having trouble, say swallowing a large pill or having trouble getting something on down, that chin tuck position is better. And so you've probably talked about it in peds and with feeding children. But what you don't want is someone to come at you from up high and make you do kind of like a bird feeding, we used to call it. Okay, and so if you are standing up over someone and looking down at them, it's natural for the spoon to come at you at a more severe angle. Okay, and that's going to cause the individual to look up, and that's not a great position for them to swallow. Okay, and so that's what we're looking for there. Is a little bit of a chin down and the head tilted forward. Also want to support the impaired side of the body. So if folks with swallowing difficulties have one side weaker than the other, say from hemiplegia from a stroke, make sure that you're supporting the impaired side with pillows, towel, lap tray. And this is something where it's really easy to get. We talk about getting laser focused on one area. And so we're just watching their face and their body and watching them being able to see that we don't see any signs of poor reactions or anything like that. And so we don't realize that while we've been working on this, that they've slumped off to the side altogether and we've lost them. Okay, because we're just right here in their face still. All right, so it's important to take that backup step, get them supported. The idea of proximal stability, right? So if they're not as worried about controlling their body in space, if they've got that kind of managed for them, they're going to be able to focus a little bit more on what's going on and really paying due attention to their swallow. Okay. So there we see sit at or below eye level. When feeding people with dysphagia, position yourself at the same level or slightly below their eye level. And that's the picture that I showed you guys, of the little girl feeding grandmother, right? Because she's already at that position. She's already below the position. And so that's causing kind of her to look down a little bit. And so that's something good too, right? Let's see, moving on, placing food in the stronger side of the mouth. So again, we talk about if someone does have a stronger side, then you would want to remember the picture of the facial weakness. You would want to put it in his unaffected side as much because he's going to tend to pocket and not be as aware of the food that's on his affected side. So you're going to want to put it on the stronger side and he may be able to handle that a little bit better. Okay. Let's see. And then positioning yourself well. And so that's where I say to you, whoopsie, uh, I say position yourself in a way that you can take in the whole picture, that you're not too high or low. And then also you'll see some pictures in your text of maybe a person coming in from behind the individual and kind of doing a more natural technique that way. It's kind of representing your hand being their hand for them. So those are some things to consider as far as positioning. Now, some of Deanna's tips that you're not going to find in the book, but that I want you all to be aware of. Okay, some things that I have picked up on my own. One of the things, you guys are going to laugh at this maybe, but don't talk too much. Okay, so it's natural that when you're one-on-one with somebody and you're having a meal, you don't just sit across the table from your friends or your family and eat in silence, unless you're giving them the silent treatment, which is not okay, but it's natural to talk to them. Okay, but I don't want you guys to worry them with questions about how was your day and how was therapy and how's your granddaughter, because they're supposed to be thinking about eating, right? And that's what you really want them to concentrate on. This is their therapy time. So while we don't necessarily think of it as a strenuous exercise or something that they need to be paying attention to because we take that for granted, I want them to be focused on it and thinking about the strategies that have been provided to them. Okay, so don't talk too much. I'm sure y'all are thinking, you wish I would take my own advice. But the other thing is sometimes it works, especially with folks who have dementia or just for a more natural setting, if you can eat with them. So positioning yourself across from them, and then you take a turn, they take a bite. You show them, you can demonstrate then what you're asking them to do. You can really assess it. And sometimes that's a strategy to have folks eat a little bit more too. Now, the thing that I will say here is that when I am of ripe old age and needing intervention in this area, I don't want you to be sitting across the table from me eating a Snickers while I am eating my pureed fish. That's not nice. Okay, so maybe you don't eat the same texture food, but maybe you all are sharing a similar meal. Okay, so that you can talk about the texture, the sensation, the taste of the foods that way. Okay, so that's not always completely feasible, and it should be slow though. It should take them time because after each bite, they need to make sure that they clear. Maybe it's been advised that they take a sip to clear their mouth. But it's going to take time. And you guys know that time and productivity are of essence in the therapy world right now. So just be aware of that and plan ahead. Okay. And then, like I said, this is an area where I want you guys to be sure to check on the recommendations that I get from my speech friends, okay? Because they had some great advice coming in. All right, now moving on to non-oral feeding devices. So this is something where I'm not saying that they didn't teach us in class, but maybe I just wasn't prepared for it. And so these are some things that you may see in acute care. You may also see in peds. These are pictures, obviously, of our peds population, but some things just to be aware of, okay? So, and it'll make sense when we just look at the pictures, but an NG tube, okay? So that's the tube that's going to go through their nose and on down to their stomach that way. Then a G tube or a PEG tube, and then a Mickey button, which is going to be the access to that tube feeding. Okay, and so as I was saying, so for example, the G tube there, I've had clients with this even in home health that were maybe failure to thrive and they were declining in their weight, and so they would have feedings and they would have scheduled feedings to try to help them increase their weight. Okay, and so usually they would be scheduled feedings. You may be able to disconnect from that site, but these are kinds of things that I just wanted you all to see and be familiar with, okay? So again, non-oral feeding devices. All right. Now, into diets. So right here, front and center with diets, I put explain the why. So the different types of modified diets are pureed, mechanical soft, dysphagia advanced. And then the liquids, spoon thick, honey thick, nectar thick, and thin. Okay, and so I'll move right into the picture here. And the top is the fluid, and I just kind of use this picture just for reference. It's a picture out of Australia, but I just kind of wanted to show you all. So a thin liquid is going to be water, your iced coffee, your sweet tea, your regular coffee, all those things, thin liquids, okay? And that's what people are used to and want, okay? Then you move into something that is more mildly thick, moderately thick, or extremely thick. And that is going to correspond then with your spoon thick, which is going to be your thickest, your honey thick, which is like the consistency of honey there, and then nectar thick. And that didn't mean a lot to me. I was like, well, how thick is nectar? I don't know that. But this picture kind of gives you a little sample there. And I think that you guys have some background with thickener. And so it's something that has to be mixed up to that specific consistency. So that just kind of helps give you a visual. We're going to talk more about it in a minute. Here are your foods, okay? So your soft, your minced and moist, and then your smooth or pureed foods, okay? Reference your book, but this is kind of what you're looking at, okay? So these just show a picture there of the same foods in the different consistencies, okay? And then here, I wanted to, you know what? I want to go back here a minute. And I want to tell you guys to explain the why, okay? And so I've shared this example maybe with you before, but say you have a client who, like we were saying before, really likes coffee every morning, okay? And he's always had coffee every morning and he wants coffee, right? And so say then he isn't allowed to have his coffee and you come in and say no more coffee, but you don't explain the why of the no more coffee. His wife picks him up a coffee, says, oh, he's not aspirating on it. You know, I didn't hear him choke at all. And we forget to do the education of why he needs this special diet, right? And so it's really for compliance, and it's your due diligence to follow up with the compliance of this, right? And so they would have speech therapy usually takes the lead, is what I'm hearing from my speech therapy friends, is that they usually have a poster followed up. A poster on the bedside or somewhere near that patient that can help everyone be on the same page that way. And so that you are able to reinforce that education and get that compliance across the board because it's critical. But what I want you guys to realize is that there are certain foods that are naturally already these consistencies, okay? And so this is kind of where I wanted to camp out because we're all about quality of life and being client-centered. And you know what? Thickened coffee is just yucky anyway. But maybe we can get them, maybe they needed nectar thick liquid anyway, and they just don't like that coffee. But maybe they like V8 juice. And you know what? V8 juice, tomato juice like that is naturally at a nectar thick consistency. And so this is exactly what we did for my father-in-law. Is he liked that stuff. I mean, that's not my jam, but he preferred that, something that is naturally thickened, over using the thickener in something that he already likes. So he also likes to drink Coca-Cola from a can. But he didn't want that mixed with thickener. And so we understand that. But he was more receptive to doing V8 juice. Okay? So this is a list that I've compiled for you guys of foods that are more naturally thickened. Okay? And you can just kind of look through that at your leisure. But pureed foods there, you'll see applesauce, mashed potatoes with gravy, mashed bananas, hummus, some people like, pudding, yogurt. So I'm going to respond better if you present one of these foods to me versus a Big Mac that you've just put in a blender, right? Yuck! Like I don't want to do that. So some folks, would handle this pureed diet better. And I'm not saying that that's inclusive, that that is all that you can do and that that's enough. But maybe it's a place to start, right? And definitely collaborate with your SLPs on this. But again, you'll see some other things there with the mechanical soft. So moves on to oatmeal, pancakes, and syrup, and you would have these things mixed in. Quickly here, a thing that I will make note of is that, you know what? I don't have time. I'll save that for the next one. All right, we'll see you in a minute.